I am Todd. I am 43 years old, construction worker since I was 17. I have a partner, 2 children, aged 5 and 7. Got a background in martial arts, weightlifting, yoga, and always been highly active. I feel like an old man in a young man's body, which is tough.
Todd has been experiencing hip pain for almost 10 years. He was diagnosed with severe osteoarthritis, or wear and tear, in his left hip 5 years ago.
The pain's gotten worse, deep aching in my glute in the front of the hip, like it's burning. I was waking up aching. The things I can't do at the moment is bending down low. My kids play footy, kicking the footy. I can kick for so long, then I've got to sit down, or I start getting sore, and then after the activity, I'll be exceptionally sore. If I let it go longer, I think I'll have more problems.
Coming down, Todd.
Thank you.
Thanks for coming in today. Tell me a bit about your hip. What sort of problems are you getting day to day with it? How sore is it?
Evenings aching is probably the worst. Clicking in the hip, grabbing, walk very slow, not very good range of motion.
So you've had these x-rays done. They show that you've got pretty bad arthritis within your left hip. We can see on the right hip there's still a bit of cartilage left and a bit of a gap between the bones, whereas on the left side there's no gap between the bones there.
Todd and his orthopaedic surgeon, Dr. David Slattery, have decided it's time for Todd to have a total hip replacement.
Todd's an excellent candidate for a hip replacement. He's young, he's fit, he's active. On physical examination, Todd has significant stiffness through his left hip. He also has marked pain upon rotational activities and movements of his hip, and the hip is very sore with characteristic deep pain around the hip region and into the front of his hip in the groin. So that's what we typically see with patients with hip arthritis. He's had a range of interventions so far. He's had injections, medications, and nothing's working for him at the moment. So this is the next step in his journey. He'll do really well. He'll be able to get back to all the activities that he wants to. We take arthritic hip that's rough and causing all your pain in there. We place a special component inside the socket of the hip, which fits in there like that. We remove the part of the hip which is full of arthritis and put a new round component in there, which fits perfectly into that socket and allows your hip to move around nice and smoothly and evenly without causing you pain and inflammation.
Dr. Slattery is expecting a good outcome from surgery.
I'd expect Todd will be sore for a week or so as he gets over the surgery, but then within a week or two I'd expect him to be off his crutches and walking pretty well, off most of his pain relief, and then by about 6 weeks I'd be expecting him to be walking without much of a limp, off all his pain relief, sleeping better and starting to get back into his normal activities and exercise. In terms of high demand physical exercise, boxing, gym, weight training, that sort of thing, he'll be about 3 months before he gets into those sorts of activities.
Rehabilitation timelines vary. It can take up to a year to achieve a full recovery.
With hip replacements, we do try to eliminate as much pain as possible with them. Ideally, we aim for a thing called a forgotten joint, which is where someone can get back to all their normal activities without any realisation they've actually got an artificial or prosthetic implant in their body.
My goal is to be more mobile, to be pain-free. That's an important one. To have better movement as well. Play footy with the kids more, be more active with them as well because they are still young. I'm hoping to be back at work in 8 weeks.
In the lead up to surgery, it's really important for Todd to ensure his muscles and general health are in good shape, which will help with post-op recovery.
I'm doing my own stretching techniques. I've got bands, kettlebells, foam roller. It is working the muscle and strengthening it up in anticipation for a good recovery.
It's operation day and there's a lot going on.
Just been admitted. Blood tests, questions, checking everything's right physically and mentally. I'm just anxious. I don't know what to expect. I've got no idea. I've done as much research as I could and I'm in others' hands at the moment.
Todd researched different types of hip replacement operations and together with Dr. Slattery came up with the best approach for him specific to his individual circumstances.
Today, the approach to the operation is we're doing an anterior hip replacement. Using an approach which involves a minimally invasive technique where we don't cut through any muscles at the front of the hip to minimise tissue damage, pain, inflammation and to expedite the recovery.
Dr. Slattery will access Todd's hip by separating the muscles at the front of the joint, then replace the ball and socket with a ceramic implant, which is generally expected to last 20 years or more. Great care is taken to avoid complications.
There are specific risks of a hip replacement, things like the hip replacement wearing out, things such as fractures, dislocations, infections. Thankfully, all those things are very rare. Incontinence and constipation are, thankfully reasonably rare conditions post-operatively. We do occasionally see it. It's normally due to medications. Normally it's reasonably short-lived, and the most important thing is getting people off whatever the medication is that's caused it to begin with.
Dr. Slattery's hip replacement surgeries usually take about 45 minutes to an hour.
Yeah, it went really well, exactly the plan. We were able to line up his hip replacement perfectly. He'll just wake up from the anaesthetic, he'll head back to the ward once all his vital signs are stable and his pain's under control. He's got a special catheter in his hip which is giving him a little trick of local anaesthetic to reduce his opiate requirements, and then he'll either get up this afternoon or else tomorrow morning with the physios and try out his new hip.
The hospital physios helped Todd out of bed using a walking frame the day after surgery, and on day 2 he was walking pretty well.
I could move around much better and freely and get more mobility in my hip whilst using the crutches.
2 weeks after the operation, Todd is going pretty well.
2 weeks down, moving much better, feel great. Obviously some surgery pain. That's about it. No arthritic pain, no joint pain, mainly muscular. The grinding in the hip and the pain there is non-existent. It was at about day 7, 1 week, that I could walk freely, slowly but freely without any walking aids. Stairs are fine, just take it slow. Pain relief, I stopped taking strong painkillers after day 6 and then mainly went on to like low anti-inflammatory paracetamol based. Rehab, I've been given the exercises from the physiotherapist, that is knee raises, not too much past 90 degrees, and mainly rear leg raises with my calf. Nothing to the side yet, it's just mainly basic.
2 weeks after the op, and Dr. Slattery's happy.
I know we had a bit of a chat about your x-rays in hospital, but this is what it looks like on the big screen, so you can obviously see the new hip replacement in here, all well aligned and everything's been restored.
Todd's doing really well post-operatively. He's doing a bit better than what we normally expect. I would anticipate that over the next few weeks he will continue to improve, and he told me that he was walking up to 2 kilometres a day, which is probably a little bit more than we'd normally hope for at this point. But I've told him to slow down a bit with his rehab. In the long term, he should be able to get back into all of his normal activities without any real restrictions. He can move his leg wherever he wants it. There are no hip precautions as such for him. He'll do fantastically.
"10 weeks post-op and Todd's powering on.
I feel brand new, fantastic, much better.
There was a slight hiccup in Todd's progress at about week 3, brought on by overdoing things.
I was walking regularly, still a lot of muscle pain, but I thought to myself that I could walk it off and get through it, strengthening that muscle up. I started swimming a bit more and kicking, again doing more, getting on the bike, a stationary bike, and pushing that muscle a lot until the muscle didn't like it at all, and I ended up back in hospital. Doctors and the surgeon said I'm overdoing it, I'm exercising too much and you need to relax, ease up a bit. Functionally I can walk, I'm average at about 8 to 10,000 steps a day. Movement's excellent. I was aiming to go back to work at week 8, but it came at week 7. I can get onto machinery fine, I can climb stuff.
Todd is now doing rehab exercises at home under the guidance of his physio.
One of my aims was to be pain-free. I am pain-free. I'm on no pain relief at the moment. One of my aims was to have better movement. That's been achieved. Definitely more active since surgery. Good, good, good. One of the things I wanted to do was kick the football with my sons and move around and run around with them. Before surgery, I was unable to do that. There is no pain afterwards at all. It's great, it's a good result. I was told that it would happen and it did. Beforehand, I felt like an old man in a young man's body, but now I feel a bit younger when the years have come back. The surgeon said, you're going to forget that you've actually had this procedure done. I think around week 6 or week 7, I was walking down the street and I was like, oh, I completely forgot that I've actually had this surgery. Definitely changed my life, definitely changed my life. It's like I've got my life back.